Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 Homeopathic Remedies for Paralysis. What is paralysis? When there is inhibition in reaching nerve signals to muscles, we cannot move muscles. This is called paralysis of muscles. What are common causes and types of paralysis? Causes: strokes, brain cancer, spinal cord injury, nerve disorders like multiple sclerosis. What is multiple sclerosis? Defined later on. Types. There is types of paralysis. Bell's palsy. Bell's palsy is this is the Bell's palsy figure. Picture. This lady is suffering from Bell's palsy. Bell's palsy means facial paralysis of the right portion or left portion. Generally, one portion is affected. In this figure, the right portion of the lady's face is affected. Look at inability to wrinkle brow. This brow he cannot wrinkle. Drooping of eyelid. A eyelid will droop and he cannot close the eyes. Eyelids are drooped, and he cannot close the eyes, open eyes. Inability to pull cheek. This cheek he cannot pull it up. Normal situation. It is already drooped downwards and drooping of the corner of the mouth. Look at the mouth. This is a natural corner. This level. Now this portion is drooped down due to paralysis. This is Bell's palsy, special type of paralysis. Other types of monoplegia. Monoplegia means paralysis of single part, say right hand or left hand or right leg or left leg. Monoplegia. Hemiplegia means this is hemiplegia. One half, right half or left half is affected due to paralysis. Paraplegia, lower half, both side lower half. Quadriplegia, whole body except head is affected. These are various types of paralysis. Now, multiple sclerosis. What is multiple sclerosis? Multiple sclerosis is an autoimmune disease where cells of body's immune system attack protective covering of the nerve of brain, optic nerve, etc., causing potentially disabling diseases. Vision problems, trouble in walking, tingling sensation are common symptoms. Symptoms may vary widely. That is, from case to case, symptoms may vary widely. This is multiple sclerosis. It's a very important term in neuroscience. Multiple sclerosis. What is the incidence of paralysis in Bangladesh and India? Out of 1 crore people, about 15,000 suffer from paralysis. What are common signs symptoms of paralysis? Reduced muscles functions, loss of sensation in arms and legs, reduced motor functions, loss of ability to talk. How to diagnose paralysis? One or more of the following tests are done: myelography, CT scan, computerized tomographic scan. The picture below, CT scan machine. Spinal tap, MRI, magnetic resonance imaging, the top figure, magnetic resonance imaging. Myelography, electromyography, muscle, various tests of muscles, and X-ray. Now, between MRI and CT scan, difference is that in case of MRI, a magnetic field is used to get the picture of various levels of the person. MRI. CT scan also uses a lot of X-ray at various places, so that the total picture gives a the totality of that X-rays gives a clear picture of disease. One is X-ray, another is magnetic impulse, using of magnetic impulse to draw an image. How cases of paralysis are managed? Homeopathic medication, physiotherapy by experts, physical exercises. How paralysis can be prevented? A few tips to prevent paralysis. The complete prevention is not possible because there are so many reasons for paralysis. But few tips. These are tips. Quit all sorts of addiction. Eat balanced diet. Maintain healthy body weight. Take regular physical exercises. Undertake medical checkup at least once a year. Discussions about treatment for paralysis with homeopathic remedies. Aconite for paralysis. Violent palpitation of heart. Congestions of blood in head. Buzzing in ears. Paralysis as soon as patient rage from recumbent positions. With chill and deathly paleness of face. Sternum for paralysis. Functional paralysis from onanism or emotions. Paralysis of left-sided organ, very important point. Sternum for left-sided organs, feeling of a load on the affected part. Paralysis from worms, spasms, onanism, emotion, so many causes. If paralysis caused by these causes, then sternum may be one of the medicines. Paralytic weakness felt particularly while going downwards. While going, the patient is coming downstairs, he is feeling weakness. When he is going up, there is no feeling of weakness. Very strange symptom. Ginkum for paralysis. Paralysis from softening of brain following suppressed foot sweat with vertigo. Trembling, numbness and formication. Situations worsen from wine, better from fiction, weakness, numbness and tremor of hands when writing. Ignatia for paralysis. Hysterical paralysis after great mental emotion or night watching with languor and trembling. Patients are taciturn and resigned. With this video ends. Thanks for listening, viewing. If you feel any problem, please write down in the comment section. I would certainly attend. Lachesis for paralysis. Paralysis of left side after apoplexy or cerebral exhaustion. Head heavy as lead. Words about occiput with vertigo. Flashes of heat. Problem worse after sleep. Great desire for fanning slowly from a distance. Tongue tremble like that of a snake. Sense of constriction and tightness everywhere like throat, lung, heart, etc. Maximum from paralysis. Multiple sclerosis. Sclerosis, multiple sclerosis. Actually, sclerosis means spine. Now, the spinal portion of this nervous system. The spinal portion of the nervous system. Actually, this nerve along this spinal portion sclerosed. That is degeneration. Paralysis from apoplexy, cerebral softening, sexual excesses, abuse of alcohol after mental exertions. Parts cold, numb, emaciated, incomplete paralysis, power of motion not entirely gone. Worse from motion, slight touch, but strong pressure relieves. Also China. When they walk, they cannot lift legs up, just drag them. Tarantula for paralysis. Great formication beginning with a strong pain in occiput followed by a numbness of trunk and limbs and complete loss of motor power. Phosphoric acid for paralysis. Cerebrospinal exhaustions from overwork causing heaviness of limbs, numbness and vertigo. Back and legs weak and burning with formication.